Half a day. As of last night, we have a total of 93 confirmed cases of COVID-19 with 4 deaths and 20 patients who have recovered. For many of the faithful, Palm Sunday is a time of hope. The declaration that in this holiest of weeks, the light will defeat the dark and life can triumph over death. As we celebrate this day and approach Easter Sunday, we must also acknowledge that faith without good works is nothing. That while we should all hope for miracles, it is wise not to rely on them alone. For us, this means that our hope must come with action, or in this case, inaction. By staying at home and limiting your social interactions, we can significantly reduce the number of cases and we will begin to see more recovery. While we have directed most people to work from home, there are so many government employees who are working tirelessly to respond to the crisis behind the scenes or on the front lines, including nurses, social workers, clinicians, and public safety officers who are performing essential services during a very uncertain and stressful time, risking their lives for all of us. This is why I will sign Executive Order 2020-08, which would implement a COVID-19 response differential pay policy. Under this policy, Government of Guam employees will receive differential pay of up to 25% of their regular wages, depending on their risk of exposure to COVID-19. There are no words to express my gratitude and appreciation for those who risk themselves to keep others safe. And while no amount of pay would be sufficient in times like this, what we can give is certainly well earned. We will do all we can to make your lives easier, and this differential pay policy is a recognition of the risk you have taken in order to do your job. Let me be clear, this policy is prospective. That means it is effective today. Unfortunately, I do not have the legal authority to apply this differential to the start of this crisis. I need legislative authorization to do that, and I have written to the Speaker requesting that authority as soon as it is possible. Since the onset of this pandemic, I took aggressive steps to protect us. I closed all non-essential government operations as well as public and private schools, and non-essential businesses and facilities were mandated to temporarily cease operations. To continue flattening the curve, I signed Executive Order 2020-09. Under this new executive order, no social gatherings of any kind will be permitted. All employees working in essential businesses or functions will be required to wear masks during hours of operation. All essential businesses must limit their transactions to essential items. These items include, but are not limited to, medical supplies, pharmaceuticals, items that sustain life, and items that maintain the home. And effective today, the public health emergency is extended to May 5th, 2020. I know there will be some out there who say that this is not enough. A letter from Vice Speaker Nelson and Senator Shelton echoed what others in the community have requested: severe action to respond to those on our island that have been unwilling to follow public health guidance in the shadow of this deadly virus. This pandemic, evidenced by how it has affected the entire world, is unprecedented in the modern era. And while other nations using extraordinary powers have had some progress in curtailing the spread of COVID-19, those jurisdictions do not recognize the same strong fundamental rights afforded to Guam's people by the Constitution. As governor, I must take strong measures to defeat COVID-19 while recognizing the rights of individuals grounded in the Organic Act. While it was my intent to roll out a series of enhanced enforcement measures, My consultations with the Attorney General of Guam make clear that this new threat requires additional enforcement powers that can only be granted by the legislature. In response, I will submit a letter to the Speaker to work with her colleagues to immediately author and pass legislation granting the governor the power to limit movement to that which is needed for the support of essential businesses, the maintenance of life sustenance, and emergent medical needs during a public health emergency. I also ask that the legislature mirror the efforts of other legislative bodies throughout the nation that have authorized methods of enforcement, including the issuance of significant fines and penalties to those who violate an executive order. While these needs are immediate, I respect that the legislature must take the necessary precautions to ensure the safety of its members and support staff amid this virus. For this reason, I urge the Speaker to act as quickly as their responsible judgment will allow. I know some of you won't understand why I can't enact stronger measures all by myself. Given this emergency, I would take those steps if I could. But democracies require balance, and the AG has made clear that the tools I need must come from the legislature. In the short time since this public health emergency started, we secured designation under FEMA as a national disaster area. We achieved reimbursable use of the National Guard under Title 32, lobbied with the state governors to receive federal authorization for $100 million in direct aid to Guam. We qualified SBA's Economic Injury Disaster Loan Program, and within 48 hours of its enactment into law, I signed the necessary memorandum of agreement to see emergency unemployment benefits on Guam. Each of our agencies is working now to get Guam the help it needs. Even as federal agencies still develop many of the programs Congress established just days ago. And right before this press conference, members of my cabinet briefed the legislature on the status of federal aid programs and what we were doing to get them to Guam as quickly as possible. Through our partnership with the Department of Defense, we will be receiving critical supplies we need to beat this pandemic. I just received a call from the White House, and I was informed that Guam will be receiving 30 ventilators. I will end this simple message: be kind to one another. All of our lives are in some way affected by this. These are uncertain times, and now more than ever, we need each other. We need each other for hope, for support, and to feel less alone. Though we must remain physically distant, remember that we are closer than we have ever been. I'd like to ask Linda DeNorsi now to come up and give a status of our COVID-19.
Thank you, Governor. Yesterday, we conducted 20 tests, and of the 20 tests, 13 were negative and 6 were positive, and 1 had to be rerun. The testing from March 12, 2020 to April 4th, 2020 is a total of 559 tests that were done. Of this number, 466 were negative and 93 were positive. Of the 93 positive cases, 84 are local and 9 are from the U.S. Naval Hospital. The 9 positive COVID-19 tests were again performed by Department of Defense's reference lab in San Diego for the Naval Hospital. The demographics are as follows for our 93 COVID positive patients. From the northern region, we have 37. From central region of the island, 36. Southern region, 13. 2 are homeless, and 5 is pending determination. That's a total of 93 individuals. In regards to the age breakdown, 0 to 9 years old, we have none. 10 to 19 years of age, we have 1. 20 to 29 years of age, 9. 30 to 39 years, 9. 40 to 49 years of age, 18. 50 to 59 years, 17, 60 to 69 years of age, 25, 70 to 79 years of age, 9, 80 to 89 years of age, 4, and 90 years and above, 1. Thus, 93 total. In regards to the gender, 49 of them are male and 44 are female. The medical status, there are 46 that are currently stable. 20 are hospitalized, and the breakdown of the hospital are as follows. 11 are in the inpatient care of the hospital. 1 is at ICU. 8 are at the skilled nursing facility. 23 or 3 more have recovered today. 4 have died. That's a total of 93. And so 32 of them are currently in home isolation. 14 are in our Government of Guam isolation facility. 8 are at SNU, 11 are at GMH inpatient care, 1 at the ICU, 23, again, as I mentioned earlier, are fully recovered, 4 have died. That's a total of 93. In regards to the travel history of our COVID positive patients, 1 is from Japan, 11 from the Philippines, 1 from Singapore, 2 from Dubai, 3 from the US mainland, including Hawaii, and 75 have no travel history at all. The numbers that are currently in our Government of Guam quarantine sites is a total of 112 of them. And as I mentioned earlier, 14 of them are in our isolation sites with the Government of Guam. In regards to the number of travelers that cleared the 14-day quarantine, on April 2nd, there were 136, April 3rd, 26, April 4th, 28, April 5th, which is today, 9. Thus, a grand total of 199 have cleared the 14-day quarantine. In regards to those that have recovered, as I mentioned earlier, 23 have fully recovered. And for those that have fully recovered, the age breakdown as follows are 20 to 29-year-olds, 2. We have none from the age group above, below that, from 0 to 29. And in regards to the 30 to 39 age group, 4. 40 to 49 years of age, 5. 50 to 59 years of age, 4. 60 to 69 years of age, 6. 70 to 79 years of age, 1. 80 to 89 years of age, 1. And there's no one in the 90 and above age bracket. For those that have recovered, 13 are females and 10 are males. In regards to the region, 5 are from the north, 10 are from central part of Guam, 8 are from the south, and there are no homeless. For the travel history, those that travel 14 days before the onset, there are 6 of them. 13 of them, however, have no travel history, and 4 are pending to be determined. Thank you.
Thank you, Linda. Are we open for questions now? Your Honor, this is Maureen. Maureen Garcia. Your question?
Are you talking to me?
Yes, Maureen, your question for the governor?
Yes. What will be the Guards' role in the coming days?
So, Maureen, the Guards will be providing security to our quarantine facilities. There would also be helping out with engineer work. I think we're also using some of their medical personnel. I think those are the major ones. Engineering, medical personnel, and of course security. They're helping with our quarantine facilities and also where the sailors are being housed. They're, I think, going to help security in the road, in the driveway to those places.
So just to clarify that question, we won't be seeing them on the road or any personnel on the road, such as the port police or GPD in the coming days?
Well, the port police and GPD, of course, and the airport are out there being as visible as they can, and the National Guard will help in any way supplement whatever security that the police might have in terms of resources that they need, so they can relieve the police to patrol more and be more visible out in the community.
Thank you, Maureen. Guam Daily Post, Nick Delgado.
Hi, Governor. So then just to clarify, since it looks like some of the major announcements you made today was the differential pay and the
Right.
social gathering of any kind, no longer, just to clarify, there's no longer any social gathering of any kind allowed.
Right.
And all essential businesses, they will be limited to what they can sell to certain medical supplies or things that can sustain people's lives and what they need in their homes. So just to be clear, as of what was announced Friday, drivers out there don't need to worry yet about displaying anything or checkpoints and the like, or when they go out to do their essential business, correct?
Right. And as I said in my release, that one of the reasons that we haven't really implemented that is because I need to make sure I have the legal authority to do it. And so that's why I'm asking the legislature to look at the policies and provide me then the authority to enforce that and to implement that.
Right. Okay. So thanks for that clarification. So to my question, if I can, so about a month ago, Governor, you projected that the COVID-19 pandemic will result in a loss, I believe, of $31 million to the government revenues. Correct me if I'm wrong or if that has changed. But this was before there was any closure of non-essential businesses and the schools. What are the new projections, and how does the administration expect to address that shortfall?
Right. So we are reviewing again the numbers to reflect what has happened so far with, like you said, the closure of businesses and decrease of the GRT revenues and so forth. So I don't have those numbers, but I think we'll be close to what we had predicted. And so basically, we will be working to give you guys those numbers. What was the other part of your question, Nick?
If it was pretty much yes, if there are any new projections and how the administration expects to address any potential shortfalls.
Okay, so for potential shortfalls, of course, we are very, very much grateful for the federal government passage of the CARES Act, because in that package, it gives, I think there's like 150 billion that they have set aside for states and territories and tribal tribunal councils and so forth. And off that 150 billion, that's a direct subsidy to those states, territories. And out of that 150 billion, 3 billion was carved out for the territories. And of that 3 billion, we will be getting 112 million. And that definitely would help in terms of reimbursing our expenses that we have already spent for human resource, equipment, supplies to counter the coronavirus epidemic and pandemic. And so that's part of the ways that we could get our shortfall.
And then my second question is for public health. I know before we had mentioned that some of the early cases had links to the Hafa Bingo Hall. Is public health tracking any COVID-19 cases with faith-based organizations on Guam, and can you elaborate on the potential exposure?
Yes, there is a faith-based organization that we have identified, and that's the Iglesia Cristo, and we're going to be coming up with all the different areas that there has been a whole congregation. So we'll be getting that out very shortly. But the answer is yes.
Okay, and so can you say when we'll be receiving that list? Because
by this week.
Okay, thank you.
My staff
Linda.
already are gathering all that information together.
In the meantime, while we wait for that list, what's your message to people? Okay.
Yes, we already send out a message for everyone to be very proactive So if they are experiencing any symptoms, don't wait for any calls to be made. Just go ahead and see, you call first your healthcare provider and go to the facility that you are seeing with your primary care doctor. And if you exhibit these symptoms, to please see them. And from there, they'll provide instruction. And if necessary, you will get a nasopharyngeal swab. And then we will be able to get that swab and test them. So that's my advice. Take the proactive approach. And that's what we have already sent out through a release through the JIC to notify the whole community to take that proactive approach.
Back to Maureen Margarita, I missed your follow-up question.
Thank you. I have a question for the governor. So I'm sure, Gov, you've seen Steve Mnuchin, the Treasury Secretary, saying that Americans will receive direct payments in 3 weeks. And I just wanted to clarify when Guam's residents can expect to see direct payments and when you will activate rev and tax.
Okay, so you're talking about the tax rebate, right, Maureen?
Yes, the direct payments to individual residents. I think 1,200
Right.
per person.
The 1,200 per person and so forth. Okay, so Daphne has been in close communications with the IRS, and she's setting up her processes now to be able to get the information, and then according to that information, we'll be able then to distribute those checks. I think how it's going to work with us is that they'll give us the estimated amount, and they'll give it directly to us, and then from there we can withdraw from that account to pay individual people their tax rebate. And just for the public, that is the one where if you're an individual income of less than 75,000, you'll be getting $1,200. If you are a couple and your income is 150,000, then you would be getting 2,400. And then as the income rises, they take away an amount based on some calculation. And also, every child under 17 in your household would be given $500. Thank you, Maureen. Kevin Kerrigan.
Yes, good afternoon, Governor.
Good afternoon, Kevin.
I'd like to ask, I understand that you need legislative authorization for some of the additional restrictions you'd like to implement. But can you tell us now what specifically are those additional restrictions that you'll ask the legislature for?
Okay, so for example, someone had asked me about could I the curfew. Could I extend the curfew to everyone and not just what we currently have in legislation? My advice from the legal people is that we cannot. It has to be through legislation. The other one was the checkpoints that I had mentioned, and I don't have authority to stop people specifically for the purpose of finding out where they're going, and I don't have authority for any penalties in terms of enforcement. That has to be legislative.
Right, I understand that. I was just wondering what specifically you're asking the legislature for. So apparently you're asking for a curfew?
I'm asking them to introduce legislation and to enact statutes so that I can then legally have the authority to do so.
To do what?
To be able to increase, to be able to extend the curfew to everyone, and to be able to establish checkpoints, and to be able to ask people where they're going, enforce it if you're not going to where you're supposed to be going, and impose penalties and fines. So it's an enforcement issue and also authority for me to implement that.
Okay, so we'll see the specifics of all that in the days ahead. I'm assuming.
It would probably, I am sending the speaker a letter like I mentioned, and they would have to draft the legislation to allow me to do that. So they are the ones that would have to introduce the legislation and pass it.
Also, I have another question with regards to GovGuam employees and pay.
Yes.
As you know, the private sector has been hit hardest by the economic impact of the coronavirus. Many have been laid off, others have had hours and salaries cut. GovGuam, I gather, was able to make payday for all GovGuam employees yesterday, and you've just announced that essential positions will be getting a differential based on their exposure to the coronavirus. Has any thought been given to having GovGuam employees in non-essential positions share the same burden that the private sector employees are now bearing by reducing their pay or cutting their hours for non-essential GovGuam employees?
No, there hasn't been any discussions on that. I still need those employees to, as we move forward, to be able to function so that we can continue providing the public services that we need to in the order of safety, public safety, health, education. So no, Kevin, there's no discussion at this moment in your question.
Thank you, Kevin. I-94, Sabrina Salas,
Hello.
Hi.
Hi, Governor. I wanted to follow up on something that Maureen had asked regarding the stimulus checks, and it appears that it's 3 weeks away. And I know this is something that other media have asked repeatedly regarding, is there any sort of local programs, local funding that can be used to help residents of Guam that have been displaced, furloughed, or their hours have been reduced?
Okay, so right now the immediate mechanism to provide local funding or local help, Sabrina, would be either through the public assistance program, which is locally funded, and through the SNAP for food stamps. I am in discussion with public health to see how much they might be estimating that maybe I could put into public assistance so that those individuals then who need that assistance can then apply and get help that way.
Okay, so we are looking at about 8,000 if we look at the numbers that from the Department of Labor and the Guam GHRA. So how long would that take?
Well, what we need to do is look at the 8,000. If it's 8,000, I don't know if that is a solid number, but say 8,000, and then would have to look at, well, what is it that we can afford given our financial situation, and then we can go from there. I can also look at, and the reason I think this might be very feasible is that whatever I then provide, it's sort of like advancing them ahead, right? For some cash help to provide them with, you know, their living and their sustainability and the sustenance. So it could be reimbursed, but I need to look at what available monies there are for me to be able to do that.
Okay. I just want
to assure the people, Sabrina, that I am just as concerned about our people in terms of helping them out to try and get, you know, like a bridge or something so that they can continue on. One of the things that we are also urging the employers is to continue employing these individuals, because if they do, they borrow money from the SBA, where there is a loan program. I don't remember the exact name of the loan program, but they can borrow money from SBA, and that one is immediate right now. They can borrow there, and then depending on their payroll, how much of those expenses or that loan is going to pay for payroll, that portion of the loan can be forgiven.
Okay, thank you, Governor. I did just have one more as it relates to your extension of the public health emergency to May 5th, I believe you said?
Yes, May
so I
5th.
wanted to know if there is any word on public schools. Are we going to see the rest of the school year?
I was talking to Superintendent John Fernandez, and he's going to, I think, take my direction, and based on what my direction is, he is considering just maybe closing school till the end of the school year. And he's already gotten together in terms of what that means with credits, curriculum, and so forth. So he's working that out.
Thank you, Sabrina. Pacific Daily News, Annalisa.
Hello. So I'm wondering why the government decided to implement these stricter social distancing measures now. Why were they not implemented earlier, or when the physicians group gave its estimates and presentation?
Well, the physician group just gave their presentation on Friday, and I had been working with my legal people to see if what I wanted to do would be within my legal authority, and found out that I haven't, that I don't have that legal authority. I also want to let you know that we're not acting just now. We've acted since March 14th, when we declared public health emergency. A couple of days later, I declared all closures of non-essential government. And then further on, I declared closures of all public places, closed the schools, closed the senior centers, closed businesses, restaurants, closed bars, prohibited social gathering, closed the beaches, closed the parks. So I've done everything where I focus on where are these public places and where is the risk of contamination and transmission. Additionally, I also mandated quarantine from passengers who are arriving from the Philippines, because we found out that the first contact source is a traveler from the Philippines. And so I strategically looked at where the cause is and then address that in a very aggressive and proactive manner. So as we also saw that the US has become a hotspot, then I mandated quarantine from those places that are coming in. So what I did is I looked at our island. I looked at how this virus is transmitted. I looked through science and experience of how contacts are done, and what can I do to decrease our exposure and our risk in further transmission and further spread of the virus. So that's why I was very adamant to stay home. I was very adamant about social distancing. I was very adamant about social gatherings. I was very adamant at situations where there is contact. And so as we learn more through science, I have instituted very aggressive measures to protect our people from being infected. And, you know, if you look at Dr. Felix Cabrera's graph and his trajectory and predictions, he said that if we didn't do anything, we would be in worse shape today. And what it's looking like is that we're containing it. And that's what I'm trying to do, contain it, so that we can flatten the curve quicker, and so that we can, again, win this battle. So I don't agree that I have not taken aggressive measures. And,
Right.
and like I said, I base my decisions on data, information, and science.
All right, thank you, Governor. And my follow-up is, you've spoken to local assistance for residents. The two options are primarily SNAP and the public assistance. But what local assistance is there for non-essential small businesses on island that now have to, for example, continue paying rent while they have no income?
Okay, so on the rent issue, my executive order said that they cannot be evicted. And I think there's also delay in rental payment. I am very concerned about the small businesses because they are the backbone of our economy. And there are many programs right now that they can institute right away to be able to help them with their cash flow, to help them with their means of operations. And so this one loan that I was telling you about, I think it's called Pay Protection Program. That's immediate right now. Banks and financial institutions are already, I think, making loans for that economic benefit.
Sorry, I just want to clarify, you said when you were referencing the executive order that mandates that they won't be evicted, you said that there is something regarding a delay in rent payments. Is that part of the executive order? Is that something that you're considering doing?
I think there was not in the executive order. So in the executive order, it was just they cannot be evicted.
But are you considering any action on rent payments?
I have not looked at that right now, but that is a possibility, of course.
All right, thank you, Governor.
Thank you, Anita. Pacific Island Times, Johanna.
Half a day, Governor.
Hi, Johanna. Always nice to hear your voice.
Oh, thank you. Okay, so my first question is, will there be free internet or Wi-Fi for students who need online classes, like for students who are going to rely on the night school or summer school, but now maybe that's not coming about? Will there be like access points for Wi-Fi or internet for them?
You know, I need to follow that up because I'm not too sure, but I know that the education benefits may be addressing that for schools, K to 12, and also higher institutions of learning.
Okay, thank you. And my next question is related to Title 2020-9, which was limiting business to essential items. Like, so what is the limit, or like what exactly does that mean? Like, for example, Kmart, it has essential items, but it also has a toy section and an electronics section. Will they have to like close their toys and electronics section?
Right. We've been communicating with Kmart. We've been communicating with the corporate office of Kmart, and we have put them on notice that they need to cordon off those areas that are non-essential items, and that they were reminded that essential items are those that are food, pharmaceutical, household wares that need to sustain, you know, like cleaning, diapers, that kind of stuff. Also, household wares that, for example, if your plumbing bursts, that you're able to quickly go to the store and fix your plumbing situation, or you need to buy wood to, I don't know, fix your roof or something, that those are still considered essential items. And so actually, if you go to Kmart now, they've been very responsive, and they have cordoned off those places that don't need, that aren't essential. And again, you need to think about the reason and the science behind that. It has shown that the more you minimize social contact, that the quicker you'd be able to flatten the curve. And so what I'd like people to do is that, you know, get their errands in order, get in the store, just pick up those items and go home, rather than, you know, mingling around the store, going around, looking at stuff. So in order for us to really make sure that that social contact is minimized as much as possible, the businesses are very responsive in making sure that the access to those essential items is the only access in the store.
Thank you, Johanna.
Okay, thank you, Governor.
All right.
Mr. Alfonso.
Good afternoon, Governor.
Hi, Mister.
First question is, do you have an indication from the speaker on when the legislature will meet? And if it's not soon enough for your liking, would you call them into session yourself?
This is a very immediate situation, and yes. Yes to your answer. I have not spoken personally to the speaker. I think I just sent her the letter. I did text her last night that a letter will be forthcoming. And so once she gets that letter, I will follow up to to quickly again ask for immediate legislation and for immediate session to pass this. They have been very generous in offering to me whatever whatever options I need in terms of helping me along with and supporting me along with the fight of this coronavirus crisis. That they are very, very willing to do it. I had met with Senator Regine Lee yesterday, and also Senator Joseph Augustine. Senator Regine Lee, of course, is the oversight for labor, which is very critical, and also Senator Joseph Augustine, who is the Committee on Appropriations Budget, and they've been very, very amenable to working with me in terms of providing the policies and the legislation that I need to, again, move forward with some aggressive actions to, again, try to contain the spread of the virus.
Thank you, Governor. And the second question is regarding the ban on social gatherings. How will that be enforced? Who will enforce it? Will it involve like ticketing people that are found in violation?
I think yes, and I think what will happen is like in public places that are already closed and they continue to, the police has authority to remove them and to impose penalties. As far as the home, Nestor, I am just again pleading to our people that I trust that they can help us with this fight and that they adhere and comply to the directives that I am putting forward.
Thank you, Governor.
Thank you, Nesta. KC7, Patty Arroyo.
Good afternoon, Governor.
Hi, Patty.
Hi. First of all, my first question is about transforming telemetry unit at the Guam Memorial Hospital as an isolation unit. Do you have an answer to that?
I have Lillian Posadas here, our GMH administrator. She could probably give you a much more up-to-date information about that.
Thank you.
Thank you, Governor. Thank you, Patty, for that question. That is our next step to then really increasing our bed capacity to be able to receive an influx or a surge of COVID positive patients. And so the telemetry unit right now has a bed capacity of 26, and it does have the central cardiac monitoring capability. So really that will be the next ideal area for us to then receive and admit the COVID positive patients get out. Does that
Lillian,
answer your question?
Yes, it does. Thank you. Have you also been frequently testing nurses, hospital staff as persons under investigation?
Absolutely. We have been, especially those who we know have come in contact with individuals who, are COVID positive. We have tested. We've tested the majority of the telemetry nurses who were exposed. And so the results have come back. 4 of those nursing staff tested positive. The others, majority of them, tested negative. We've also tested some of the ones in the surgical floor because there were some patients that were transferred from telemetry to the surgical floor. Those individuals, those patients and staff who took care of those patients directly, they were also tested, and they all tested negative.
Thank you, Lillian. My last question is for the governor. Governor, if you don't mind. Is the Guam Department of Labor any closer to working out with the U.S. Department of Labor, how to clarifying how to get unemployment checks to local unemployed?
Yes, they've actually, like I said, the first thing we did, which I did like I think a week and a half ago, Patty, where it was required to sign a memorandum of agreement with the U.S. Department of Labor. That was the initial one. And then Dave has been working very closely with his counterparts to set up the process and the program. And they've been submitting that so that we can all understand exactly what is going to happen. So I can't give you a time frame because I think they're also still providing guidelines, the federal guideline. So as soon as we get all that, know that we will just distribute it out as fast as we can.
Thank you, Patty. Closing remarks from the governor?
Oh, okay. Again, thank you very much to the community. And as we look at the historical actions that we have done, I just want to assure the community that we are doing everything we can possibly do within legal authority and as humanly as we can. I want to thank all of the team that work on this. We've been working 7 days a week, making sure that we are there for you, making sure that we have all the details. Believe me, every day it's an evolving situation. Every day we think our processes are right on target, but then we have to readjust them. We have to be flexible about them based on what the situation is. I also want to say that one of the biggest positives is that we have such a great community support out there. I have support from the nonprofit organizations, the business community, the military, every entity that we can think of are just helping out. We have people that are also providing some relief and respite to our frontliners, either in the way of just baking cookies and give it to them, or just giving them some really good positive inspiration and encouragement. Any little thing helps. And this is going to be very taxing and very burdensome on our frontliners. And I'm concerned about their endurance in working hard for this, for our people, for the safety of our people. And that's why I developed a differential pay policy to compensate them for all the hard work, the risk that they're taking out there, from the fire department, police department, our nurses, our doctors, our public health surveillance team, our ER people, everybody in the front line, and also those that help and support them at the back end. Those are also as critical people as we need them to help support our frontliners. I do know that I also have great support from the federal level and of course from the military, and they're also helping us bringing in our supplies. We are keeping a close watch on our supplies. We are looking at what our burn rate is for masks and so forth. And I have been getting good responses from them. I would like it to be faster than what we are experiencing, but we are also part of the whole United States and the whole world in terms of this pandemic. And so they're scrambling, they're struggling. Supplies is a big issue, but we're right in there also trying to get our supplies and our test kits and so forth. So I just want to again say thank you for the patience and the understanding from our community. Thank you for all the prayers that you have been giving our frontliners, our people who are working, because without your commitment, your support, and your understanding, we cannot win this battle. And again, I cannot overemphasize, please stay at home. Please help us decrease social contact. Please make sure you do social distancing, because everywhere in the world, when you read about their experiences and their advice, the one thing they say is stay home, social distance. Stay home, social distance. Thank you, and Sujus Masi.